Welcome to the Am I Mental podcast, the Doctors in Court edition. Today, I'll discuss a case that challenges everything you and I assume about the doctor-patient relationship and trust. In this case, I'll be talking about Dr. Stephen Kwan. This is a name that unfortunately has recently become infamous for all the wrong reasons. And his name is real. The case is also real. And his story is one of betrayal, complex motives, and ultimately devastating and life-threatening consequences. As always, I want to note that this episode contains real details. These are court case findings. I haven't changed any names today. In previous episodes, I've changed names to protect people's identity, but this case has really shocked the world of medicine until recently. So the focus is on Dr. Kwan. He's an experienced anesthetist. He's used his medical knowledge not to treat people, but to harm a family member. And his action has shooken and literally taken upside down his complete community and medical professionals worldwide. Let me start with the timeline. Stephen Kwan wasn't new to the medical field. He was a trusted anesthetist. But his relationship with his family, particularly with his mother and her partner, Mark Harding, was fraught with tension and resentment. And by late 2023, Dr. Kwan began planning something unthinkable. In November of 2023, he forged letters. He created a false identity as a community nurse in order to gain access to Mr. Harding's home. By the time he arrived in the home in January 2024, everything had been planned down to perfection. Harding believed he was simply getting a COVID booster from a healthcare professional. And so imagine his shock when after he gets the injection, he is in excruciating pain and he's rapidly deteriorating. It's really terrifying because moments later, Harding was rushed to the hospital and the symptoms were far from anything normal. Hospital staff noticed signs of necrotizing fasciitis. That's an aggressive flesh-eating infection. And investigators soon found that this wasn't a medical accident, but it was deliberate. Dr. Kwan was accused of being the orchestrator, and he used his medical expertise to ensure that Harding suffered. Let's take a look at the plaintiff's case. Mr. Harding's legal team made it clear this was a cold, calculated assault disguised as medical care. And in court, Mr. Harding described the betrayal and the psychological trauma he now experiences. He struggles to trust anybody working in the healthcare field, and he has endured pain, which wasn't just physical, it's deeply and emotionally harmed him. Because Mr. Harding's trust in healthcare was completely shattered, he was also diagnosed with post-traumatic stress disorder, and basically means that he suffers from flashbacks, panic attacks, and intense anxiety around doctors. This is an unimaginable situation for someone who once respected the medical field. Harding's attorneys argued that Dr. Kwan violated not just the trust of one individual, but of the entire community. They contended that when doctors exploit their medical knowledge for harm, it causes a ripple effect, casting doubt on the integrity of healthcare professionals as a whole. The defense team made a compelling case that the actions of Dr. Kwan was not only malicious, and he had no remorse, but it was devastating in that the breach of confidence was completely harmed. And not only for Mr. Harding, but for anyone who hears this story. Now, on the defense side, Dr. Kwan's attorney argued that this wasn't just a case of malice. They painted a picture of a man who'd been wrestling with emotional scars from childhood, suggesting that unresolved grievances with his family led him to this destructive path. Dr. Kwan's attorneys introduced a psychological evaluation describing Dr. Kwan's distorted thinking and long-standing issues with entitlement. They attempted to contextualize his actions within a narrative of deep-seated family conflicts and psychological strain, arguing that he wasn't a danger to the general public. But how does that hold up, especially when we're talking about an act that was so thoroughly planned and executed? This wasn't impulsive. He actually calculated his every step. He forged documents, and he used his professional knowledge as a weapon. Now, the defense rebutted all these arguments and pointed out that his training and deliberate actions made him a continuing risk. The judges had to face a complex question. Was Dr. Kwan someone who acted out of extreme emotional distress, or was he someone who crossed a line that put others in danger? And ultimately, they leaned toward the last point. And after weighing both sides, the court sentenced Dr. Kwan to 31 years in prison. This wasn't just a criminal sentence. It came with severe professional consequences. He was also declared a dangerous offender and permanently barred from practicing medicine. Now, for the medical community, this was a firm stance on ethics and patient trust. The court's message was clear. Medical expertise is not a tool for personal revenge. And by losing his license, Dr. Kwan effectively lost his identity as a doctor, a punishment that perhaps runs as deep as the prison sentence. The court wanted to make sure that anyone with similar intentions would think twice, knowing that medical skills, when misused, would be met with the harshest consequences. So let me take a moment to unpack some medical terms used in this case. First, necrotizing fasciitis. It's also known as a flesh-eating disease. It's a rapid, deadly infection that requires immediate surgical intervention. In Mr. Harding's case, this infection was induced, which is extremely rare outside of bacterial infection context. And PTSD, or post-traumatic stress disorder, as we mentioned earlier, is a psychological condition triggered by traumatic events. Symptoms include intense fear, flashbacks, and in Mr. Harding's case, a lasting mistrust of healthcare professionals. Thank you for joining me. This was a very short podcast simply to highlight this case. It's very rare that a doctor of this type of status, or any status, mind you, would commit such a heinous crime where he thought about it, planned it to the point of forging documents, and although I didn't mention this, he actually wore physical disguises in order to enter a trusted family member's home. Whatever the issue was at that time, whatever the grievances he had with his mother, it does not give him any right to do what he did. And this sentence is one of the harshest I've actually read for any doctor to receive. It will set an example for anybody in this kind of position who wants to commit such harms and breach that much trust in the community. They need to face severe consequences. And let's hope that Dr. Stephen Kwan, who no longer actually can be called a doctor as he's been stripped of all his titles, will ponder in jail and reflect on his actions and hopefully also get the help he needs, since he too, according to his lawyers, was suffering from a lot of emotional scars from his childhood. Thank you for listening and take care.